Hi, I'm Dan from Correct Osteo Clinic, and today I'm going to talk to you a little bit about common disorders of the spine. So here's my model that I always use in clinic to explain to patients. As you can see, it's already got what's called a disc herniation on it, which looks really quite aggressive and nasty. However, so I'm going to talk to you a little bit more about actual intravertebral disc problems to start with. So when I say intravertebral discs, not many people know what that actually means. So it's the actual spongy discs between the bony ones. Okay, so you've got these building blocks on the spine, all right, and in between those bony building blocks, there's like a very spongy like disc, all right, that allows for things like shock absorbing and so on. These here are, I always try and explain them to patients like jam donuts. So they've got a fluid within the middle of them called your nucleus pulpus. That's like the jam within the donut. And it sounds a bit strange, but it's got layers on this sort of donut. So it's a bit more like an onion. Okay, so within the center of the onion there's like a liquid, and then you're going through these layers. These layers are called annular tissue. Okay, so what happens is when you say get a slight bit of damage to this this annular tissue, this annulus, within the intravertebral disc itself, it can cause a bit of inflammation in that area. Obviously, with inflammation to the area, you get like a migration of blood vessels within the actual annular tissue. Okay, so the nucleus pulpus, that sort of jam within the donut itself, is made up of things like glycoproteins. So when this tissue gets inflamed, like I said before, you get this migration of blood vessels, and then what happens is you start getting a mix between like oxygen between the glycoproteins. Okay, so some people may know that when glycoproteins mix with oxygen, they become calcified. All right, so then it predisposes you to like further problems down the line. Obviously, when that liquid within these spongy like discs becomes sort of like quite calcified, so it's predisposing you to further issues along the line. So the probably like the least bit of problem you can get with these intravertebral discs is like an annular strain. Okay, then the next is probably a disc bulge. Okay, so you'll get like a slight bulging. That's when the jam within the donut, like I said, that nucleus pulpus, that fluid starts to migrate towards the outside through the layers. All right, so it starts to come more towards the outside. All right, the most common ones are posterior lateral disc bulges and herniations. Okay, because at the back here you've got what's called your posterior longitudinal ligament. So a ligament is basically in the way from it going straight back. It normally goes backwards and then slightly diagonal. All right. However, that's a problem, because if it does start to do that, say with a disc bulge or a herniation or even a prolapse, which I'll explain to you in a minute what they are, at the back and lateral to these areas, so a little bit towards the outside, sort of diagonal, you have these nerve roots. So as you can see here, these yellow like structures which come out of the spine, you have like these nerve roots that are sitting in these spaces here. And if then the problems like the bulges and the herniation start to push backwards and then slightly diagonal, these are in the way. So then you get these problems that are compressing, caused by compression of these nerve roots, and then these can cause what's called like radiculopathy. So these neurological pain symptoms like that along these nerve pathways. Okay, so going back, let's talk about the disc bulge there. A disc herniation. So the bulge is where it's that nucleus pulpus, that fluid-like liquid, is starting to push more towards the outside. So starting to go through the inner layers of that onion, pushing more towards the outside. So then the outer layers start to bulge out slightly. A herniation is even more severe. So it's like an increased amount, basically. So on here, this is like a herniation. So this nasty looking red thing here. on this intravertebral disc, this is like where it's really sort of herniated outwards. Okay, so that liquid inside there is really starting to migrate towards the outside and push through those layers. And then the most severe probably case of where there's an intervertebral disc problem is a disc prolapse. So the liquid inside that nucleus pulpus has made its way completely outside, and that's a real inflammatory problem there. So that liquid will start to basically inflame the surrounding tissues, and it's really normally quite severely painful. Alright, so at the back of the spine, we've got these little joints. Okay, these are called facet joints. So you might be able to see here these slight little facet joints. If I rotate the spine here, they sort of like knocking on each other. So facet joints here are little joints at the back of the spine that reduce you from going into far too much extension and allow like a sliding movement, so forward into flexion normally, and they'll give like you in specific areas of the spine that allow you to go through like rotation and also like side bending as well. Alright, within the lumbar spine is probably one of the most common areas. So when I say lumbar spine, you've got different areas of the spine. So the lumbar spine is the very bottom part of the spine. Okay, it's made up of 5 different layers, so 5 different building blocks. So you'll start from L5, so lumbar 5, 4, 3, 2, 1. Okay, and then you've got your thoracic spine, which is made up of 12 different building blocks. All right, and they've all got these intravertebral discs between them, so those jam donut-like structures that I was telling you about earlier. And in the cervical spine, so within the neck, the spine of the neck, you've normally got 7 different building blocks there, so 7 different vertebral bodies, and then you've got the vertebral discs, intravertebral discs, sorry, between them. All right. So within the lumbar spine, as you can see here, it's probably one of the most common areas that you'll get like a facet irritation. It's normally characterised by quite sharp pain directly probably over the area, and again that can cause an irritation of the nerve roots around the same sort of area, then causing that radiculopathy, that migration of pain down and following that nerve pathway. So that's what a facet joint is, or a facet irritation. However, these are actual joints, so they have got a capsule around them, and you can get what's called a facet capsular irritation. Slightly different symptoms. It can also be more painful with even like things like flexion, so where you're opening up those joints, you're stretching the actual capsule itself, and again, if that's inflamed, if that's quite nasty and aggravated, that can cause quite a bit of irritation, as they are highly innervated as well by nerves, just like what the sinovertebral nerves, which are innervating the intravertebral discs like we talked about earlier, those jam-like donut structures that are in the spine. You can get what's called foraminal stenosis. So it just means that these little holes here within the spine, just at the back of where the intravertebral discs are that we were talking earlier, there's a little hole. Okay, so there's slight little holes here, and the nerve roots can start to come out of these holes, so they start to come out from the actual spinal cord itself. So the spinal cord is encased, it's like protected within this like big bony structure, this big strong rigid bony structure of the spine. You get like that movement of the spinal cord within it, so it's a big thick, as you can probably see on the video, that big thick yellow looking structure within the spine, and then just off of that you got the nerve roots that pass out through these what's called foramens, these holes within the spine itself. So going back to obviously the disc problems and the facet issues, when you get a compression of say facets, so when they compress together, normally in the lumbar spine when you're going into extension, when you lean back, those facets start to come together and press together. And also you can get a closing or what's called a stenosis, so narrowing of the holes within the spine, so those foramens that the nerve roots pass out of. So it's like I always call it the garden hose effect. So it's like you turning on the garden hose and you're pinching it, you let the hose pass through your hand, and then you constrict and start to compress onto the hose. It's going to then affect the rest of the hose, just like a nerve root would. Okay, so it's like you compressing on the hose again, and it's affecting the pathway of that hose, just like a nerve. Alright, so the nerve root can get compressed and affect the pathway of the nerve. Alright, so that's another issue there. So you've got that foraminal stenosis, which we just explained, and then you have what's called central stenosis. So that is actually when I talk to you about the spinal cord itself. So the spinal cord runs right deep within the actual spine itself, and it's called the spinal canal. So it runs all the way to the brain and all the way back down again to like the sacrum and so on. So as you can probably see there, that's where the nerve roots that will pass all the way there. However, the actual spinal cord stops at the level of like L1-2. Okay, so then it starts to have nerves that will travel further down, like a horse's tail. So it's something called cauda equina. There's something called cauda equina syndrome, which is like a medical emergency. So it's the nerves that supply the bladder, the testes, and so on, and down the leg as well. If that gets compressed or affected, that's actually a medical emergency. However, we're just talking about that. The name of it is actually called cauda equina. It just means horse's tail. It's just where the spinal cord ends, and then the nerves will then travel further down than the spinal cord within the area, looking like a horse's tail. Alright, so the central stenosis is where there is basically a stenose, so that a narrowing of the spinal canal, so the area of where the actual spinal cord runs through. So that's what's can cause that problem. So multiple issues can actually cause that. So a space occupying lesion, so something within that area that can be pressing onto that area, or say like where you get like a degeneration of the actual spine itself, where it's starting to get compressed. So bony landmarks can then start compressing outwards and then can compress into the actual spinal cord. So that's a little bit more severe than that foraminal stenosis. So also you can have what's called a spondylolisthesis. Big horrible word, sounds terrible, but all it is really is a forward slippage of a intravertebral, a vertebral disc. Okay, so it's sort of happening there, if you can see it ever so slightly on this spine. However, the most common area for it to happen within the spine is at L5. Okay, I think like something like 85 to 90% of spondylolisthesis actually happen at L5. So they're different grades of spondylolisthesis. Grade 1 is 0 to 25%, where it comes forward from 0 to 25%. 25 to 50% is a grade 2. 50% to 75% is a grade 3. 75% to 100% is a grade 4. And a grade 5 is basically where it has fallen off the shelf. Okay, so with obviously that movement of the vertebral body, you can obviously get a disruption of tissues around the area. So like we were saying about the nerve roots start to get compressed, there could be like an irritation to the actual intervertebral disc itself, even an irritation or a compression onto the spinal cord as well. Okay, so that's quite a severe sort of case. But however, quite a lot of people, and it's very common to have like grade 1s, grade 2s, grade 3s, but when it gets like, real past that, you know, everyone's different though. Everyone's spine is different, so you could get a severe amount of pain with a grade 1, and probably, like, you know, and again a severe amount of pain you should do really with a grade 5. You know, that would be really severe with a grade 5. So yeah, everyone's different in that sense, how they feel pain and interpret pain. The most common probably issue that we see is muscular strains. So as manual therapists, you know, we see muscular strains near enough all the time, every day. You know, the back is such a strong and big, powerful and rigid structure. You have a lot of musculature that attaches to it. There's loads of different points on the spine, as you can see, all these like bones that poke out and you know, are really like quite prominent in certain areas. These are basically anchor points for things like ligaments and musculature. So these are really quite important for movement and stability of the spine. You obviously have things like your psoas muscle that attaches to your lumbar spine, vertebral bodies and intravertebral bodies as well. It's a big, powerful muscle that helps with flexion of the actual waist. Okay, so lumbar spine flexion and pelvic flexion as well. Okay, so like that sort of movement. Okay, you have also these sort of erector spinae muscles. So they do exactly what they say on tin. They erect the spine from a more sort of flexed position to an extended position. So that's a very common thing. A lot of people, like in gyms and so on, doing things like deadlifts, maybe like form is slightly wrong, maybe like while they're doing squatting, or even, you know, doing activities, it could be anything really, can get a strain within these muscles. So you've got like loads of sort of different layers, more powerful muscles, to then quite small, quite precise muscles that are very close to the spine, like semispinalis, rotatoris, multifidus, and then, like I said, the big powerful muscles, you know, the bigger sort of erector spinae muscles, like, you know, longissimus thoracis, and so on, that you know, travel quite far up the spine as well, such as, like, well, the shorter ones, more powerful ones like quadratus lumborum, attaches to, you know, the iliac crest, like 12th rib, and some of the transverse bodies as well in here. So you've got your spinal, spinal processes. Okay, so I forgot the name for a bit then. So you've got your spinal processes, spinous processes. These sort of bones that poke out here. Okay, so they poke straight sort of towards you if you're looking at the spine from the back, from behind. And then you've got your transverse processes as well, so they poke out more towards the side. So obviously, like I was saying earlier, these are the sort of different landmarks that even like your ribs will attach onto and join onto on these areas as well, within the thoracic spine, that sort of mid back. Okay, yeah, so that's a few common disorders that we see, and we are sort of treating, you know, we try to help people as osteopaths. So hopefully that sort of opened your eyes a little bit more to what we can do, and, you know, how we can sort of examine and, you know, assess how we go from there and come to that sort of diagnosis procedure. So hope to see you soon. Thanks.